So this is the positioning for the treatment, and I got direct skin-on-skin contact on the sacrum, and just pushed gently inferiorly, and I maintained that for 5 minutes. And so I'm going to take the pillows out, and we'll retest mobility. So here's tailbone, and the hand falls on the sacrum, and I take up the slack, and I can spring it. Oh. Can you capture the feet? So I'm repeatedly springing it. Okay, keep it there on the feet, and I'm now testing backward bending. Good, nice, good, and then show the sacrum, please. So now I can take up some slack, and I can spring it, and there is backward bending. And the upper sacrum, I can take up the slack, and I can get some springing, and so I expect L5 to move. And there's spring at L5, and you're fused at the level above that. Yep, right here, boom, there's no movement. Okay, let's keep filming. Let's have her get up and walk up and down the hall and tell us how you feel.
Okay.
And we can keep her face out of the film. Immediately, I see arm swing. That was absent with the first film. She was just very rigid. She was also side bent to the right. I don't know how that would help a side bending pattern in your body, but it looks better.
Feels better.
Yeah, tell me how you feel.
I feel looser and freer.
Uh-huh.
It just feels like walking is easy.
Uh-huh.
Feels good.
Nice. And you've had a hard time with walking.
Yes.
It's been
Yes.
very limited, right?
Yes.
Because of pain.
Yes.
And the pain was where?
Pain is right here.
Yeah, you're overlying the sacrum.
Right.
Okay.
Yep.
Let's keep filming, and let's have you lie on your back.
Okay.
As I mentioned, after you restore motion in one direction, you have to retest everything.
Oh, yes.
Okay. A typical pattern with the forward bent sacrum is for the pelvis to be tilted anteriorly.
Oh.
And I couldn't perceive that it was, but let's take up the slack and let's spring it. And I don't know your norm, okay? Because I get recoil. You know, maybe this is your norm, or maybe we can improve this motion.
Oh.
Okay, so pay close attention to the amount of mobility I'm able to extract. So I take up the slack here, and then I spring it, and it bounces back. Okay, so we'll treat this by having you gently hug your knee outside of your shoulder. Can you do that?
Okay.
Okay, so take your left knee, take it outside the right shoulder. Good, and then just stretch very gently. And I'll set a timer for 2 minutes.
Okay.
And we'll do it on both sides, and then we'll retest it so we can stop filming. Thanks.